Is it possible to reverse pre-diabetes and or type 2 diabetes? And if so, how quickly can you see that reversal in your experience?
Absolutely, yes. You can reverse prediabetes and type 2 diabetes. These are elevations in blood glucose that are above what is typically seen and lead to really bad things like diabetic complications like blindness and kidney failure, amputations, heart disease. It's not a path you want to go down, or if you're on that path, you need to know that you can reverse that, but you have to understand it's the sugars and the starches and the foods that raise the blood glucose. And then it's the abdominal obesity, what you started out with, the belly fat, that whether it's from wheat or from beer, that creates the environment called insulin resistance, which might be pre-diabetes in the doctor's terms. So absolutely, these are reversible. And 100 years ago, before there were medications, I have a textbook. If you come to my office, I should have a show and tell sort of thing that I do in teaching. And 100 years ago, the low-carb keto diet was used to treat diabetes because they knew it was the food and the sugar that in the drinks and the food that raised the blood sugar, and they didn't have medication. And so it was very effective, actually, to use a low-carb diet to reverse and even now prevent. It's interesting because I can see things in my office, in my clinic, that aren't in the research publications yet. And I used to be that kind of doctor, where, well, if it's not a randomized trial, it's not in a publication, I can't believe that it's true. Well, I had to visit doctors who were using this method and other weight loss methods to see it for myself. And so what we see in the clinic is way ahead of the clinical trials. The obesity studies are out there and done. Their meta-analyses on low carb versus low fat, and low carb basically is as good or better in every case. There was that study. For diabetes, there are more and more studies, but you get this weirdness of Virta Health, which is a very high-tech answer to blood glucose and blood ketone measurements, and you have to have a scale, and you have to have an app to talk to the doctor, and it's thousands of dollars a month. Well, it works without all that stuff if you just cut the carbs out of the diet, and they use a low carb diet of the 20 or 30 total grams per day. So absolutely, these conditions are reversible by changing the lifestyle and really just the diet alone. And it's so unbelievable, people don't believe it. So it's that case where you have to come to a clinic where it's happening to believe it, or talk to doctors on the internet like this who are in a clinic where they see this. Things change fast, though. In the last year, I get people coming to me now already fixing their diabetes without me. And that's good. I mean, the only worry I have is if someone's on medication that can become too strong, the medications can become harmful. And if you don't get off them really quickly. And so to your point, you can reverse diabetes in a day. If someone is drinking 2 liters of sugar beverage, which I've seen, 2 liters a day, and they're injecting insulin to cover, basically to treat the sugar they're drinking, they stop drinking the sugar and they get off the insulin in 1 day. But so you have to be measuring your blood glucose in order to react and adjust back down or even eliminate the medication. So that's kind of that sort of information. A lot of non-physicians don't want that out there because it could be, harmful. But then keeping people on medication and having them eat carbs is harmful in the long run. So that's an interesting finesse of a lot of the books that are written don't teach the really strong version because anyone can read a book. Anyone can do that. But I think now we're able to teach the detail of being very careful of how to get off insulin, and with the advent of the glucose monitor or even the finger sticks, if you measure your blood glucose before taking insulin, you're protected, because when the blood glucose is down, you don't take the insulin or other medications. So this is the fun I have in my practice now, I learned how to do this for obesity and heartburn gets better and all these other things. But people who've been on insulin for decades, coming off insulin, there's no one happier. I mean, but my other doctor said I could never fix this. Well, did they ever talk to you about what you eat? I mean, in detail? Well, no, they never. Right. So my secret weapon is food and biochemistry. What a great combination. Calories are important, no question, for weight loss. But it's not helpful. So the best I've heard it said, Gary Taubes has a segment where he says, what if we were looking at a restaurant and you ask me, why is it crowded? And I say, well, more people went in than came out. Well, no, why is the restaurant crowded? Well, more people went in than came out. So there's this, yes, more calories went in than came out, but that's not helpful. Why is the restaurant crowded? Is it great food, great service, a great view from the top? So Gary, I loved his way of putting that into a different metaphor. Of course, it's about calories if we're talking about weight loss. Now, David Ludwig, who is at Harvard, is a little more, should I say, diplomatic, and he calls it so Gary basically says these people they're just kind of stupid, if you're focusing on calories, because, yeah, of course, more people went in the restaurant, but David Ludwig calls it a tautology, which I had to look that up. I'm liberal arts trained and then in medicine, but I don't know that word. Of course, David Ludwig would find it. Tautology means it's true. So in a compromised paper that David wrote mainly, and we contributed to it, he brought together the calories in, calories out people and the carbohydrate insulin hypothesis people, the scientists who see this paradigm. It's like looking at the elephant and, it's a trunk. No, it's a tree. No, it's a wall. So he calls it a tautology in that paper, which really kind of means that people, the CICO, calories in, calories out people, are basically saying that more people went in the restaurant than came out. We know what causes a crowded restaurant. And, when Gary wrote or talked about that on a podcast, I went back to meetings and I couldn't listen to those folks anymore because they had that paradigm view that we know what causes obesity. It's just calories. No. So then I meet doctors who are using low-carb diets, Dr. Atkins, Dr. Eads, Dr. Rosedale. They didn't talk about calories, but the calories went down. And they were just cheeky enough to not say that that's really what happened. So, but really, it might be, I guess, more honest to say it's a low-carb diet that leads to a low-calorie diet. But they just wanted to be a little different. And so they never said, well, it just lowers the calories. But now when it comes to diabetes, there's a big difference between eating the same amount of calories of sugar and the same amount of calories of fat in its relation to the blood sugar elevation. The blood sugar is going to go up because of eating the calories that are made of sugar. The fat itself doesn't raise the blood glucose. So when it comes to diabetes, there's a big difference in the calories, the type of calories you consume. But there was a program in Durham, North Carolina, in the States. Duke University had it for a while, and it went out on its own. It was called the rice diet. So when people hear, oh, you're at Duke and Durham, what happened to the rice diet? Well, it doesn't exist anymore. But it was rice, fruit, and fish for a weight loss program. But they didn't get much rice, right? So it was 800 calories per day, where most of us need 2,000 to 3,000 calories a day. So it was ultra low calorie. And that also is the Pritikin and Ornish type of diet, where it's ultra low fat and low calorie at the same time. But I prefer to eat the foods that are available on low carb, high fat diets. It's just tastier for me. And the calories that are kept down because the hunger is kept down. You're not in that kind of junk food and constant carb eating. And you wouldn't know it that carbs make you hungry until you stop them. And then you realize, why am I not hungry? Oh, I'm not eating the carbs. Or is it the ketosis? Or is it the... So that's one of the problems with this area I've been in putting studies out there. People would say, well, you don't know the mechanism. And well, it might be 10 different things. I'm not so focused on the mechanism, but our reductionist researchers are. They want to know the mechanism that causes fatty liver, for example, without regard to the inputs into the diet. And I can fix fatty liver by changing the carbs and changing the food. But the experts want to know, well, independent of what food this person's eating, what can we do to fix fatty liver, when you don't need to fix the fatty liver if you stop the cause in the first place? So that's part of the confusion too. Our reductionist scientists want to know the one mechanism, and that's what's getting us into this whole drug treatment, the shots for obesity now. Because if you isolate one hormone that's really powerful, it can be helpful. One of my patients watched the shot discussion on TV, and she looked at me and said, that's the same thing that happens on a low-carb diet. The food noise goes down, the hunger goes down. Why are they just talking about the shot? Oh, right. It's something you can sell, right? And people think they can't give up their fruit or their chips. So it's an interesting thing, but yeah, carbs make you hungry, and you wouldn't know it if you didn't stop them. And this has been known for a long time, and it does boil down to biochemistry and physiology, and sadly, students aren't being taught this. I can pretty much, I'm at a university and where we have really smart medical students and smart internal medicine trainees, and I talk to them about this. For some of them, it's the only half day, meaning it's the only 4 hours of nutrition they're getting in their entire experience. So I have to be really quick. And what are you made of? First, well, water, then protein. So what do you think we should eat? Water and protein. Yes. I think 1 out of 50 trainees, I can lead them to that. Otherwise, it's usually, well, we need fruit, right? No, we don't need to eat fruit. So anyway, when you come down to first principles, what are we really made of, and we need to replenish, it's protein. I mean, water is a given, but so when you come at that angle, it's pretty easy to figure out what to eat. So I could talk about basic nutrition and science. Again, it's like we're just following what the food does into our body. It's science.
Hey, if you enjoyed that video, check out this video here, which tells you how to get rid of that stubborn belly fat.